With Will Lawrence. He covers veterans for NPR, and he's in our studio now. Good morning.
Good morning, Renee.
The summer of 2014, why were veterans then having to wait so long to see a doctor?
The root cause was that the VA didn't have enough doctors and nurses at a time when millions of Vietnam and Korea vets are getting old and needing more care, and also a lot of Iraq and Afghanistan vets were entering the VA system. The scandal that summer, which cost the VA secretary his job, was that some VA clinics were cooking the books to hide the fact that vets were waiting so long.
So Congress and the VA tried to fix this, so tell us more about what they did.
Congress passed a big reform bill. It included $10 billion for the Veterans Choice program, which was supposed to fix this problem. They even sent out a card to all these vets so that they could take that card and go see a private doctor if they live 40 miles away from a VA facility or they'd already been waiting 30 days for an appointment. So it was supposed to be a very simple idea. It didn't turn out all that simple. Despite seeing 3 million appointments outside the VA system in the past year, wait times are worse. Compared to 1 year ago, there are 70,000 more vets right now who've waited more than a month to get an appointment.
Well, how did wait times actually go up?
The VA says it's because they had a massive increase in demand for care. But when we've been looking at vets trying to use this Veterans Choice system, it doesn't look like the program really made things go smoother for them. From the start, it was so confusing that veterans didn't understand it, doctors didn't understand it, and even the VA administrators were admitting that they couldn't really always figure it out. We've been talking to veterans and doctors across the country about this.
And we've got two reports coming up right now.
Government, health care,
incomprehensible? He's with Montana Public Radio.
Montana has more veterans per capita than any state besides Alaska. This winter, Montana Senator Jon Tester sent his staff to meet with veterans in 28 towns from one end of the state to the other. Scenes like this one were typical.
The VA can't do it in 7 months, 8 months, something's wrong.
That's Bobby Wilson, a Navy vet served in Vietnam. He's trying to get his hearing aids fixed, but can't get approval for an appointment to do that.
3 hours on the phone with her. Not waiting, talking for 3 hours trying to get this thing set up for...
Hospitals, clinics, and doctors across the country have complained about not getting paid, or only paid very slowly. Montana Senator Jon Tester says Billings Clinic, a network of 12 hospitals, never even signed up to be part of Veterans Choice.
Biggest healthcare provider in the state of Montana won't deal with choice. That should tell you something's wrong with the program.
The VA and its contractors point out that when Congress passed the Veterans Choice law, they only gave them 90 days to get it up and running. And the VA was requiring tons of extra paperwork before outside doctors could get paid. Still, Senator Tester has little sympathy.
90 days is 3 months. And all they had to do is schedule appointments, develop partnerships with medical providers, and pay them on a timely basis. And they haven't done that.
HealthNet declined to be interviewed for this story. But in a statement, the company says the VA has recently reduced the paperwork requirements, and that's helping to streamline Veterans Choice. Vietnam veteran Bobby Wilson, though, is almost at the end of his rope.
If I knew half of what I knew now, back then when I was just a kid, I'd have never went in the military. I see how they treat their veterans when they come home.
For NPR News, I'm Eric Whitney in Montana.
Okay. This, for 2 years, has been a very just strange situation. I understand. We have to get our veterans help. We ask them to do something we don't ask other citizens in our country to do. And I understand that they wanted to set up a separate health care system specifically for veterans that would be designed for the types of injuries and issues that are unique to veterans. But when that system is is in overtime, that there isn't enough hospitals and doctors to take care of them, to me, the solution is not to set up a separate insurance that some places are involved in and some places are not. To me, the solution is to just put them on a Medicaid program. If they can go to the doctor of their choice at a VA, great. If they can't, then they should just be in a Medicaid program. All the hospitals and doctors are already set up for that. And they will be able to get paid without this extra work. It's already a system. All they would be doing is adding some people to it. It seems like such a simple solution. I don't know. What do you think?